Hasan Sheikh, who is the vice chair of Canadian Doctors for Medicare. He's also an emergency and addictions medicine physician in Toronto. Actually has to go and do a shift after this. And an assistant professor at the University of Toronto Family and Community Medicine Department. He holds a master's in public administration, and he is a tireless advocate. I know I keep saying this, but it's true, for better policies to address health inequities, including pharmacare, dental care, substance use, and the impact of precarious work on health. Hasan, welcome.
Thank you so much, Nancy. I want to start by acknowledging that our healthcare system, like every healthcare system in the world, has its challenges. And our healthcare system, like every healthcare system in the world, is buckling under the strain of COVID-19. But when we see a public healthcare system under strain, as Natalie brought up earlier, we always see this tired, repetitive playbook of calls for privatization. And we don't have to look that far back to see the perils of privatization. Just a couple months ago, you saw what happened with COVID testing. When the province restricted access to COVID testing, that was a strain on the public system, and private COVID testing centers exploded, charging up to $400 a test. And at that time, I work in the emergency department, as Nancy mentioned. I saw a flood of people coming to the ER, a place that is already busting at the seams, or we're already, doing hallway medicine every day. And people flooded to the ER looking for a COVID test, begging for a COVID test because they couldn't access one in the public system outside of the hospital. People who told me that they needed a COVID test to access the paid sick leave that they had, or people saying that they needed a COVID test to figure out, who's going to take care of their elderly parents, or people who were frankly just looking for the same peace of mind that those who could afford to pay for a COVID test had access to. That drove patients to the emergency department, and that put even more strain on our public healthcare system. And we see this cycle keep coming up. We see strain on the healthcare system, we see calls for privatization, and if we go down that route, we'll see further strain on the healthcare system and further calls for privatization. And there are two ways, and it's important that we recognize the two different ways that calls for privatization come. They come with calls for private spending, and they come with calls for private for-profit delivery. And when it comes to private financing, or people being able to pay to access care on a priority basis ahead of others, I just want you to think about the last time you were at the grocery store. You're waiting at the checkout, you're waiting in line. And if the person behind you could go in front of you because they pay, well, that just means your wait gets longer. We're just rearranging the line. And it's because we have limited resources when it comes to doctors and nurses and infrastructure. And when you introduce this parallel private system, all you do is rearrange the line. And that's exactly what we've seen in places around the world. Australia introduced a private parallel system. And what they found was that wait times for surgeries in the public system increased as it drew resources from their public system to their private system. So the other way that you get calls for privatization is, as some of others have mentioned, private for-profit delivery. So we still fund things publicly, but now some of that money has to go to line the pockets of shareholders and investors. So that doesn't make a lot of sense, right? There's kind of red flags there that probably won't improve care. And that's, the concerns that we see play out with the evidence. We saw that for-profit long-term care homes had much higher mortality rates, 78% higher than the municipal public operated homes. And so we see that quality of care suffers. There's an incentive to cut corners. There's an incentive to spend less on actual direct care. And it's not just quality that is at risk of suffering, but actually when we look at the cost, it doesn't seem to be saving us any money either. This government right now is looking for expanding for-profit private cataract delivery. And the estimates that they have themselves is that it's going to cost 25% more for each cataract surgery than it will in our current non-profit private delivery setting. So we're getting less and paying more. when we privatize. And so if privatization isn't the answer, how do we address the real challenges that are facing our healthcare system? Well, the first is properly financing our healthcare system. The biggest challenges that I see in my practice actually come from the 30% of our system that is private already. It's the lack of prescription drug coverage. That means we have no bargaining power from a single payer system, and we pay some of the highest costs for drugs in the world. It's the lack of dental care, which means that 1 in 5 Canadians can't access oral health care, and your oral health is a critical piece of your overall health. Or it's the lack of access for mental health care. We talk a lot about the surgical backlog from COVID, but there's a mental health backlog that's coming as well. And right now, that is only, treatment is only available to those with the ability to pay. And so it's important that we not just fund our healthcare system properly, but that we actually properly coordinate its delivery. And this is where, as we talk about the surgical backlog, we talk about the challenges facing our system, I think it's important to realize that actually not only is privatization not the answer, but public healthcare is the answer. We've seen what can happen when we properly coordinate our system. In the COVID pandemic, we've been able to move patients between ICUs and match needs and resources because we have a public system. And when we talk about the surgical backlog, well, that exists because we were able to ramp down our surgical cases to free up capacity for really sick COVID patients. And that's something you might not be able to do if you have a for-profit hospital that deems that hip replacements, just the margins are too good, so we couldn't sacrifice that profit margin. So there's lots of ways for us to address the challenges that are facing our healthcare system, ones that are rooted in equity and fairness. We can use things like centralized wait lists for surgeons, so you see the next available surgeon and drastically reduce your wait times to see the specialists. We can use allied health professionals, like pairing a physiotherapist and an orthopedic surgeon, to triage those referrals, reduce the strains on our surgery referral system, and actually do the prehabilitation that patients will need if they're going to get surgery anyways. We can do things like electronic consultations to reduce wait lists for specialists and best use our resources in the most efficient way possible. So you see, when the healthcare system's under strain, we always see these zombies of privatization keep coming back to life. And we have to ask ourselves, when we see these strains on the healthcare system, who are the people that are most affected by it? And when you look at that, they're definitely the people who are not going to be helped by privatization. So we need to look at strengthening our public system. We have to fund things appropriately, but not just that, we have to take ownership on the coordination of that funding and of that care, so that we can have a system that lives up to its potential, a system that provides high quality care for every Ontarian based on their need and not their ability to pay. So thank you so much for having me, and thank you for all the work that this coalition does in really defending our public healthcare system.